It is 12:04. Dr. Payne Show. Dr. Lou is here ready to answer all your questions. Phone lines are wide open. Bring them on. 416-870-6400, star 640 on cell. Free consultations, by the way. So get the ball rolling. See if we can help you here, or see if he can help you here this afternoon over the next hour. What's been happening, my friend?
Same old stuff, John.
Yeah, man.
One of the interesting cases that I had this week, which is similar to the things that we've been talking about over the last few weeks, of pain in an area being misdiagnosed by someone else, and then I'm able to, with my team, able to find out the source of the problem and get it treated right. With leg pain, a lot of our listeners obviously have experienced sciatica, which is pain down the back of the leg into the knee, sometimes even further into the lower leg and into the feet. Something that's not as common but does happen is when you get that similar type of shooting pain into the front of the leg, down the quadricep and into the anterior knee, which is the front of the knee. And I had a gentleman who came in who listens to the show, and he was complaining of this type of pain. And he's been seen by his family doctor, another clinic, and he has a bit of both going on. He has some pain going down the back of his leg, which is primarily what he's getting treated for, and that's getting much better. But the pain in the front of the leg, he's not getting as better from, and it's more of a chronic condition. Right. So there's a couple things that can cause that, similar to when we've spoken about when you have sciatica, that it could be due to a tight muscle, or it could be due to a herniation, etc. So same type of thing with that type of characteristic neurological pain in the front of the leg, where the person, it could be due to something like a disc herniation, but higher up. Most sciatic nerve disc herniations happen lower down, L4, 5, L5, S1. With the anterior leg, the anterior thigh part, those disc herniations would be more related to L1, 2, L3, 4, that type of thing. And it's more related to the femoral nerve versus the sciatic nerve. Other things that could happen is that nerve has to come across into the anterior hip and go through the inguinal area, and tight muscles in that area can cause that problem. So, and that's the most common reason why you would get that. And so he had been told previously that was the source of his pain. That was likely some type of a disc herniation that was also happening higher up, causing those symptoms. And again, we've spoken about this before, where just because you have something on imaging, but you don't necessarily have the clinical symptoms, it's the correlation of both things that really matters, not just looking at images and looking at clinical symptoms as two different things. They have to be put together. So in treating him, and as I was able to speak to him, I found out a couple key questions that I was asking him. One of the interesting questions that I asked him was, does hot water make this issue feel worse in the anterior thigh?
Like if you're in a bath?
Yeah, like you're taking a shower or a bath. With nerve issues, especially because that type of pathology in the anterior leg, which is called myalgia paresthetica, affects the cutaneous nerves. Cutaneous nerves being the sensory nerves actually in the skin, versus the sciatic nerve is not a cutaneous nerve. That hot water or any type of temperature to a nerve aggravates the pain, where it's like, oh no, that really bugs me. And he actually said, no, warm water feels great on that. It feels awesome. I tend to get better. And he said, actually, during the winter months, when I'm outside, I tend to feel worse. So now that starts to change my thinking. I'm thinking, okay, this doesn't sound so much like a nerve issue anymore, as much as it may be a referral pain from a muscle. And so there's a lot of pain, or a lot of different muscles in the glute area, and also at the side of the hip and in the anterior hip, that can mimic that type of myalgia paresthetica pain. And sure enough, start going into some trigger points.
Gluteal stretching, stuff like that.
We find the trigger point that's causing that stuff. And the gentleman doesn't live close to my main clinic, so he's being treated somewhere else, where he's actually happy with the treatment that he's getting. So I simply just sent a letter back to the treating professional, suggesting that they would also want to consider trigger point therapy and active release therapy, or myofascial release therapy, in order to get this person better. So this happened literally a few days ago, so we'll follow up with him. But I'm confident that now, treating that aspect and not just treating it as a disc herniation, he'll start to get better, because I'm pretty confident, I'm 99% confident that it's just a muscular issue with a referral pain from the muscle versus a nerve issue from the spine.
Would acupuncture fall under the banner of release therapy?
It would
would
be
it work for him?
You could use acupuncture on a trigger point. So when I say a trigger point is an area that's going to cause a referral pain. You can use a couple things to get those trigger points better. You can use pressure with your fingers. So just a therapist will apply pressure, and as the pain starts to release, they press deeper and deeper. You can use an acupuncture needle where you actually go into that point. You could also use things like lidocaine injections into that point. There's laser therapy that you could use on that same trigger point. So there are various modalities that you could use to treat that trigger point.
We'll take a short break. Phone lines are wide open. You got questions, concerns, bring them on 416-870-6400 star 640 on cell. Just getting warmed up. Reminder as well, free consultations. You heard him mention a couple times dropping by the clinic. Dr. Lou is there. It's info@paincarecanada.com and 1-855-55 Dr. Lou. Lots more of the Dr. Payne Show coming right up. Talk Radio, AM 640. It is 12:12 on a Saturday morning here. 416-870-6400 star 640 on cell. As always, we love your phone calls coming through. We have some open lines. You got some concerns, some problems, bring them on. Dr. Lou is here to answer them. Asmina, good afternoon. How are you?
I'm good. How are you today?
Excellent. What's your concern?
Bell's palsy.
Okay.
So a couple of weeks ago, I guess my son must have woken up with it, and
Yep.
Since then we took him to the Emerge, and they prescribed some steroids to him
Yep.
for a week. Heavy dosage of steroids, 10 pills per day for 5 days.
Right.
And then, of course, you reduced it down to 8, and then 6, and then 4.
Right.
Some antivirals too.
Okay.
3 times a day, and follow up with the doctor, with the family doctor. Family doctor said, "Oh, good, just hang in there. Time, wait." When I talk to friends and colleagues and research on the Google, they say acupuncture.
Yep.
They say EMS machine. They say MPS machine. So a little confused now.
Yeah, so let's start for our listeners who don't know what Bell's palsy is. What Bell's palsy is a paralysis, and it's often temporary paralysis of the facial nerve, which is the seventh cranial nerve. The cranial nerves are the nerves that come out of the brainstem and supply mainly the neck and up. And it supplies a lot of vital things. So the seventh nerve, which is called the facial nerve, is responsible for the motor component. So a lot of the faces that we make when we smile, wink, et cetera, that's all done by the facial nerve. And you have two facial nerves, one on either side. And Bell's palsy often affects just one side of the face. And these people will actually look like, one side is actually like almost
drooping.
It's not working at all. There's no motor component. So you ask them to smile, and it looks like that split personality type of disorder. I actually know this well because when I was I think I had just finished high school, and my girlfriend at the time, who's now my wife, all of a sudden got it out of nowhere. So I learned it before I actually got into the healthcare world. But so understanding, as you were saying, that it is a nerve issue. When we look at it, we don't know exactly what causes it. The reason why your son's been put on an antiviral is because it's thought to be in relation to some type of a virus. So they try antivirals in order to eliminate if there is some type of a virus going on to help it. The other thing that they give is the corticosteroid treatment, because steroids just help the healing process everywhere in the body. So anytime someone's really bad with whatever, they're always going to give a heavy corticosteroid in order to try to get that issue better, because it just expedites the healing process. But you are absolutely right. Understanding that it is a nerve issue, there are other things that you can do that stimulate nerve from a more manual perspective, such as the acupuncture or electrical stimulation through like a TENS machine or an EMS machine. It needs to be done properly. I would definitely suggest that this is something that, you don't necessarily want to go to someone who's never treated a Bell's palsy case, but does acupuncture and get acupuncture from that person. You'd probably want to go to someone who has done it quite often and has seen multiple of these cases. The other thing that's very important in Bell's palsy is, are you having your son do any type of exercises where he's, like, for example, you're telling him smile, and although he can't, is it the right or left side that has the paralysis?
Right.
The right side. So when he's smiling, the left side is smiling and the right side is not. Yeah. Have him imagine that the right side is, right? So that you're also trying to trick the brain and get that whole belief, right? Because it's a neurological component. So there's a lot of exercises related to him actually forcefully trying. And although he's not doing it, he's making his brain believe that he is, because he's imagining it. The other thing you can do is with mirror therapy. And Dr. Rossi, who we've had on the show before, does a lot of this type of stuff where you could trick the brain by putting a mirror so that when he's looking into the mirror, he's only seeing the good side, but it seems like the right side is also smiling or doing those things, and so you're tricking the brain. Wow. This is all interesting stuff that's come out of UCLA. But yeah, I would say if you're not getting it treated in that regard right now, and you're only focusing on the corticosteroids and the antivirals, I'm not sure where you're located, but if you give us a call, I can help find someone who does have good experience with treating Bell's palsy, and we can get your son hopefully expedited through the process. But oftentimes it is self-limiting.
Okay, please, because right now, so basically, I did give him the exercises. He's trying his best, but I don't think he's doing enough. Like, he needs a little bit of.
Where are you calling from?
Well, we are in Brampton.
Okay, yeah. So my main clinic where Dr. Rossi is actually, and he's there today, is in Etobicoke. If you want, I can give you the number directly to that clinic.
Yeah,
you can even give them a call right now. And that number's...
Sure. I'll take the number 1 second. Yeah, thank you so much. Yeah, what's the number?
416-744.
Okay.
7900.
790. Okay, 744-7900. Great. Thank you so much.
No problem.
And it's nice to hear that somebody who has experiences, like you've seen your girlfriend, and hopefully, things will go better for him too.
Yeah, thank you.
Appreciate that, Esme. That's pretty. Is it generally temporary, Bell's palsy?
Yeah, it is generally temporary. When it's Bell's palsy, other things can cause paralysis of the facial nerve that's permanent, such as a stroke, right? It's the same type of symptom that you would get or sign, which is paralysis in that nerve. But Bell's palsy is thought to be due to a temporary paralysis, again, most often from a virus. It is a scary thing to see. I haven't seen it firsthand. When I didn't understand this, we freaked out, right? My girlfriend and I.
Having a stroke or something,
I didn't know,
right?
I had no idea what was going on. I didn't even know what, the symptoms of stroke at the time were. I was completely ignorant towards, this type of healthcare. And it was freaky because you're looking at somebody and half their face is not moving. And it often starts like most neurological things start. She started initially complaining of like numbness, tingling on that side of her face. And then the numbness and tingling all of a sudden started into paralysis, and just one day she woke up and half her face wasn't moving. But one of the things that I did do, and inherently I guess I knew at the time, I don't know how I knew, but I did tell her, force yourself, like keep thinking about it, keep forcing yourself,
exercise it.
Yeah, and she was better in a week and a half. So
no kidding. Wow.
It was pretty quick, and she has no residual from it. Sometimes if it does go too long, there could be some residual effect where you can notice that one side may be just a tiny bit droopier than the other, but she's had no residual effect. And it is self-limiting, but it can be scary for sure if you've never seen it.
We'll take a short break. Keep this in mind. If you want to give us a call, we're going to be talking about New Year's resolutions, those that have failed for you because of injury or other components. Want your phone calls, 416-870-6400, star 640 on cell. I know Dr. Lou's got a lot to say about that. Info@paincarecanada.com through email as well. And back into the show here in just a couple minutes. The Dr. Payne Show, Talk Radio, AM 640. 416-870-6400, star 640 on cell. Lines are open. We're going to get into the conversation of New Year's resolutions. There's good and bad. Good for guys like us who go to the gym all the time because the new people come, they pay for all the new equipment, and after a month they disappear and you never see them again.
They disappear for sure, I definitely need to get back into it much more. That's one of my goals. Definitely over getting busy with work, I've gained some weight, so yeah.
It's Christmas, son.
Christmas.
You told me what you did over Christmas. I know you gained some weight.
It's been more than just Christmas. It's been about 2 years that I've been bad.
So talk a little bit about that. I mean, you see it come to your clinic all the time, and it's not so much people saying, they stopped going because they don't want to go to the gym because it was tougher than they thought, but they get in there all full of, pea and vinegar, and I'm going to lift this and crank that and run this. All of a sudden, something pops.
And you know what? Most oftentimes, in our listeners, you can do your own research. Talk to people who have had New Year's resolutions to get in shape, et cetera, et cetera. And the biggest thing often is that they were going to the gym and then they hurt themselves and they had to stop for a period of time. And, it's psychological when you're trying to get healthy. You kind of got to do everything right. And if you do one piece that's not right, then everything else falls off the train, right? So you get hurt, you stop going to the gym.
And it knocks you down,
Now
right?
all of a sudden you're like, well, I am going to eat a little unhealthy and et cetera, et cetera. So it's very, very important for your body to stay healthy and you able to continue doing those things so that it doesn't stop. Now, we've also talked about before, a lot of the times there's prevention, right? You could do these things, get screened before. We do functional assessment screens where we look at people before anything that they would start doing. And we basically, in that functional assessment, we're essentially identifying what their capacity is at that point in time, right? So you're gauging their strength, their flexibility, and you're just letting them know, here are your limits.
Might be some red flags there you want to watch out for.
Previous history of injuries. Anytime we see people, one of the first things that we're asking is previous injuries, because, if you've had a knee injury before, you're likely to suffer that knee injury again, especially if you're not doing the right things to prevent that. The other thing is just simply gauging the progression of your exercise. People, will often go back to the gym and they haven't been either in months or years, and they were very fit at one point and they think they can go back to the exact same thing. And that's not always the case. You have to crawl before you can walk. You have to walk before you can run. And those are all very important steps to take. Gauge it. The other thing, when you do gauge, when you progress through health that way, is you eliminate the potential for plateau. Right? One of the biggest things that people face is they plateau because your body adapts to whatever you're doing. That's where you need to constantly increase either the intensity, the frequency, the duration in order to limit that adaptation of the body. So starting slowly and moving to more rigorous exercise regimens is good because it prevents injury, and it also will help to prevent plateau.
416-870-6400 star 640 on cell. James, good afternoon. How are you?
I'm doing good. First time caller, long time listener.
Thanks, man.
I have a question. I've been playing piano for many years, and my hands seem to start to tense up.
Mm-hmm.
And I just want to know what the cause of that is. My doctor is always telling me that it's overuse, but then it's happening on a continuous basis. So it's happening on both of my hands, where I'm feeling a lot of pain in my hands.
Right. Have you done anything to treat that?
No, I haven't done anything to treat it.
Right. So the way you have to think about this, your doctor, in a way, is actually absolutely right. It is overuse of an area of the body, right? When you're playing the piano, there's a lot of intricate movement going on in that area and in your forearms that control all your digits to play that piano. And over time, your hands do tense. The way you got to think of it is, a track star, right? Like if you're an elite athlete and you're a track star, they probably get their legs treated often because there's a soreness component, right? And I'm saying that kind of sarcastically because of course they would. Your hands are now elite athletes playing the piano when you're doing that much piano playing, especially if it's something that you do on and off where you're not used to it. But I know we have a lot of actual high-end musicians like piano players, violin players, guitar players. I play guitar myself, so I know exactly what you're talking about. I don't play that often anymore, but definitely your hands in that instance become an elite athlete. There's a lot of movement, a lot of intricate movements going on when you're playing the piano or any type of instrument that, of course it will cause soreness, because think about this. If you took a light weight and you did, 1,000 bicep curls, would your bicep hurt the next day?
Sure.
Absolutely. So think about if you practice the piano for half an hour, how many times did you just activate that muscle, similar to you activating your bicep with a curl? So those are things that do need to get treated. There's also, besides getting treated, there's the right way to take care of things. So protein is very important. Getting good amounts of protein to help injuries heal is important. So nutrition matters, right? Making sure you have water, because what's our body? 70% water. And most athletes will tell you that they consume a lot of water. And water doesn't just need to be consumed in terms of, tap water or a bottle of water. There's water-rich foods, right? Fruits, vegetables, sprouts, those are all water-rich foods. That's why it's really not rocket science. It's simple when we're looking at things. The good things to eat are fruits, vegetables, and those things, because they're real foods, they're water-rich foods. That's what our body's made up of, right? So there's a lot of things, James, that you can do, and it definitely sounds like it is due to fatigue and overuse. And fatigue and overuse needs to be taken care of, right? It's just the reality. There's no, I'd be lying if I said, there's a quick tip that I can give you and you'll never have that again. The reality is you just got to take care of it.
Is there exercises that James can do?
Well, the thing is, he's playing the piano. That is exercising, right? So the biggest thing that James could probably do is rest. And use things that soothe it. So muscles tend to respond very well to heat. So, maybe every night you put a hot pack on each of your forearms on either side and you relax. Because again, a lot of people worry about the issue with this is all the tendons that cause your fingers to move are actually in your forearm. That's where the muscles are located. So a lot of people will massage their hands or put heat on their hands.
Smart.
But you're just going to the end of the muscle, to the tendon. You got to put the heat, the massage has to be concentrated in the forearms, because that's where those muscles are happening. Okay. Give us a call. We can definitely have a consultation and go from there.
It's like a Formula One race car. Every 15 laps, you get new tires, oil change, and they're back out there. You got to take care of it, right? If you're doing it at a high level.
I know a lot of the people that were mentors of mine, that was the analogy that they would use with people all the time. Our bodies are our cars. We don't, you don't buy a car and then never do anything to it for the rest of its life. You put fuel in it all the time, which is the energy, like nutrition, the things we put in our body. And then sometimes, you have to change the tires. You have to get new spark plugs, et cetera, et cetera. That's treatment. Our bodies deserve the same respect as the machines that we so often know. We know we're looking at these computer screens, and these things need constant updates, software updates. Our bodies work the exact same way. We got to take care of them.
Jim, I see you there. We'll hang on for a second. We'll get to you. And if you want to give us a call, we'd love to hear from you. 416-870-6400. Concerns, those resolutions. Did you injure yourself? Are you trying to get back from an injury to get back into the gym? Give us a call. We'll deal with it. Dr. Lou is right here until 1 o'clock in the Dr. Payne Show. Talk Radio, AM 640. 12:32, Saturday morning, a cold one out there. You're feeling the aches and pains, the joints. This is a day you're going to you feel it big time. As the older you get anyway. Got Jim here in Barrie. Hi, Jim. How are you?
No, I'm not doing too bad, actually.
Okay, what's your concern?
Yeah, well, I've been diagnosed with a hernia.
Okay.
I've seen the doctor and had the tests, and then seen the surgeon. I'm scheduled for surgery, but it's not going to be for months. So I'm working on modified duty. I'm just doing driving,
right?
But no lifting or anything. But I find in the days I do work, at the end of the day, I'm in quite a bit of pain.
Mm-hmm.
And my concern is, am I doing more damage?
What type of hernia is it, Jim?
It's an inguinal hernia.
Yeah, the inguinal hernia.
Inguinal?
Yeah. Is there an actual visible bulge or something that you can touch?
As soon as I stand up, it bulges.
Right.
And if I lay down, it flattens out again.
Okay. Have you ever been told that you can buy bracing for that actually can keep it in a certain position even as you're moving around when you're against gravity?
No, nobody.
Yeah, there are certain belts and things that you can buy, hernia belts, that will help to keep that herniation in place. It acts as if it was your abdomen, right? So I would say, if that's the one thing that you're not doing, it's definitely something to have a discussion with your doctor before the surgery, where you get one of those belts to help it. Because, are you doing more harm? Hard to say, right? I'd need to see the extent of the hernia, but definitely if you're saying that it's bothering you, well, that's not good. And there are other things that you can do to prevent it and keep it stable, right? Because that's the most important thing. And so maybe wearing a hernia belt or something like that is of potential benefit, but it's definitely something that I would suggest that you speak with your doctor about for sure.
What define a hernia? Because we've seen it, we hear people have them all the time. We see them, like you said, a bulge sticking out of someone's gut.
A herniation is essentially when there's some type of material going through some other type of material. The herniation it's the same as when we say a disc herniation. Right. What is a disc herniation? There's a weakness in the annulus, the fibers of the disc, and the pulposa, which is the jelly in between, starts to come through that. And then you can have herniations like inguinal herniations, which is a piece of your intestine falling into the inguinal canal. Which in males is where the testicles cords are, and et cetera, et cetera. So that's essentially what a herniation is. It's just when some type of tissue is going through another type of tissue, and shouldn't be. And with any type of abdominal hernia, such as in this case, the dangerous part is strangulation of the abdomen, right? So actually it's kind of contrary that the big hernias are not as dangerous as the little ones, because it can strangulate more easily because it's so tiny, right? So versus having a bigger one where there's, the bowel can still do what it needs to do. But all of them should be treated for sure. Right. And there are things that you can be doing up until the time of surgery to help keep that stable, like the supports.
416-870-6400 star 640 on cell. Roy up in Etobicoke. Hi, Roy.
Hey, how's it going?
Good, pal. What's up?
Okay, so a little bit about myself. 31 years old, 6'5", roughly about 240 pounds right now. So I put myself at about 20, 30 pounds overweight.
Okay.
Right now, I'm just experiencing chronic fatigue. I sleep about 12 hours a day, every day, and I always feel tired. What could be a possible issue with that?
There's a lot of things that can cause chronic fatigue. When did this all start?
It's probably been an issue for at least the last year or two.
Year or two, and have you gone to get blood work, things like that done?
I've had blood work done. There was no issues at the time.
Okay.
But, it's just it's a daily, just always feeling bogged down.
Okay, and when did you have this blood work done? Like, was this 2 years ago when it started, or more
I would say
recent?
about a year ago at this point.
Okay, and everything on that blood work was fine.
Yeah, there was no issues. I think there was one thing where, because I'm asthmatic as well.
Okay.
So there was a little bit of concern with my asthma control, but
Right.
it's gotten much better since then.
Yeah, so asthma definitely is something. Your breathing is very important towards having the right amount of energy because it brings nutrients to your body and helps expel all the toxins. You say that you're about 20 to 30 pounds overweight. Is that new, that you've put that weight on very recently, or it's kind of been there for a long time?
So it's probably the last, about 2 to 3 years, because
Right.
I used to be in really good shape. I was doing Muay Thai like 3 times a week. So
Right.
I was at one point about 185 pounds,
Wow.
which is quite lean for my height.
Right. So for 6'5", that's pretty
incredibly lean,
So
yeah.
so for sure that type, it's very characteristic with athletes or people who train like athletes anyways. That once they start to fall out of shape, then their body responds to that, right? And so you become fatigued and things get harder because your body's used to performing at such a high level. And someone like you who was Muay Thai, 185 pounds at 6'5", and now you said you were 250?
240.
240. That's a significant amount of extra weight that the body's not used to. It. Does it account completely for fatigue 12 hours a day? No, but it may be a component of it, right? There may be a part of that. There could be other things where that weight gain that you've had, is that when I say by choice, like making poor health choices, or you've still tried to train, eat healthy, and you're just gaining weight?
Well, I sort of shifted my training over to weight training, so I've been putting on a lot of mass as well. So I won't attribute it all to like body fat.
Right. Okay.
But definitely, like, there was a period where I was traveling a lot, and that obviously encompassed like, a lot of late nights and drinking and whatnot. So
For sure.
I definitely know there's a lifestyle choice in there that is attributed to the weight gain as well as building mass.
Right.
But it just seems like it's, like the level of fatigue I experience on a daily basis just seems disproportionate, I would say.
Yeah, for sure. I think the big thing in these types of scenarios is a lot of the times when you have issues, you have to peel away at the onion to figure out, okay, what exactly is going on. So again, you're right. It may be a component of it. It may not be the full thing, but you wouldn't know that for sure unless you tried to change that aspect. So I would recommend, for 10 days or 15 days, like a good trial period, get really healthy, lots of fruits and vegetables,
Right.
Try to do more the cardio based, breathing exercises versus the weight training, and see if that helps. If that starts to help, now you're all of a sudden peeling away that onion and saying, okay, yeah, I feel substantially better. If you're sitting there and you say, well, I only feel 10% better, then maybe you're right. It's not the full picture. But if you do that and you say, you know what, I feel like 90% better, then maybe it is the full picture. And in the absence of doing those types of, self-clinical trials, you won't really know.
Great. Okay.
And I would definitely recommend follow-up blood work. All that stuff for sure is important. Anytime you're having chronic fatigue, you want to make sure there's a lot of things that can cause fatigue, low iron, changes in complete blood cell counts,
Right.
et cetera, et cetera. So those are important things. It doesn't sound like that's what's going on, but
You can
it's
always check
important
it out
to check
for sure. 416-870-6400 star 640 on cell. Got some time for your calls. 20 minutes left here on the show as we continue to get back into our topic of New Year's resolutions. Broken bones, possibly, but there could be other reasons why. We'll get to all that and injuries that go along with more of the Dr. Payne Show coming right up. Talk Radio, AM 640. We got open lines. You want to give us a call? We have time, and we'd love to speak with you this afternoon. We were talking about off air with Roy, the chronic fatigue. There's also a mental component to that too. I mean, I'm not saying that's his case, but it could be a recent breakup or a death in the family. All that stuff can factor into big time.
Well, one of the biggest things with true depression, and again, this isn't specific to Roy because it didn't sound like it,
Right.
but just on that general topic with fatigue, one of the key things with depression is constant fatigue, right? Constant burnout, feel like they don't want to
Don't
do
get out of bed.
anything. Yeah.
Yep.
And so, it doesn't sound like that because he's saying that he wants to work out, et cetera, but it doesn't have to be as far as depression. Maybe you're right. Maybe there's another component. There was a recent breakup, death in the family, et cetera. All those things do affect the mental component. And, the mind and the body, they work together. One affects the other and the other affects the other. So you got to take care of both for sure.
416-870-6400 star 640 on your cell. Dan, good afternoon.
Hey guys, how's it going?
Good. What's happening, brother?
So I got injured last year. I was playing I was doing wrestling with some of the guys, and I injured myself. Somebody slammed me to the ground, and I separated my acromioclavicle. And I've been on disability ever since. So I was awarded. Now, it's been going on for more than a year, and the pain is still there.
Okay.
So I want to know, like, how long is how long does the injury last? Like,
Sure. So let me ask you something. When you say a separated clavicle, do you mean that it was dislocated, like at its attachment with the acromion, or the clavicle broke?
No, it was dislocated. Like, nothing broke, but the tendon
but the ligaments. Was it a complete tear of the ligaments?
It wasn't complete, so we did an ultrasound, so it wasn't a complete tear.
Do you know which one of the ligaments was the one that was affected?
I'm
not sure. Okay, yeah. I mean, and so you're saying this happened last year?
It happened last year.
And you've gotten treatment for it, or not at all?
Actually, not last year, in 2015.
Okay, so even a little bit more. Any treatment during that time or no?
I've had physiotherapy and ultrasound and all of that, and it's been there. Like, the pain it's there. Like, I can't get rid of it.
Right. And it's in the actual, like, at the point of the separation is where you feel the pain?
Yes, exactly. Right. Like, the moment I raise my arm, I just feel a sharp aching pain. Like,
right. Yeah. Yeah, I mean, the difficult part with separations is they tend to affect ligaments. And we've talked about this before. Ligaments and tendons don't have the great supply that muscles have. That's why when you go to the gym, work out, and it's sore, it tends to feel better in a few days because there's lots of nourishment going on in those areas, versus the tendons and the ligaments are not vascular type of tissues. And so blood flow tends to be limited to those areas.
Okay.
And so one of the modality interventions that really tends to help with that type of stuff are things like modalities that actually help the healing process to promote blood flow. So things like laser therapy help to promote blood flow to the area. Release therapies in that area help to promote blood flow. Activation of the muscles help to affect blood flow. It's a more complicated case than is easy to describe on the radio, for sure, because of how many ligaments are involved in holding the clavicle in place. I can see, Dan, you're calling from Mississauga. It's definitely something we could take a closer look at, and I can give you specific answers. Most simple soft tissue injuries, the research suggests should get better within 12 weeks. And in the absence of not getting better in 12 weeks, then you start getting into the chronic stage. And once you're in the chronic stage, things become harder, right? We've talked about this a lot, that once things go on for too long, there's a learned component to that pain, where your brain now starts to build pathways that even in the absence of actual physical trauma, your brain can still make you experience that pain that you once were feeling in that area, just because of the very nature of how powerful the brain is. It's the same thing that we've spoken about with phantom limb pain. Although there is no limb there, people can feel pain in that area. So yeah, it's definitely, Dan, something that I think is worth assessing with us properly, so we can give you proper answers, because there's a multitude of factors that could be causing the chronic pain that you have.
Dan, the number 1-855-55 Dr. Lou is one to have on you, and use it if you like after the show. Got Craig up in Thornhill. Hi, Craig.
Good morning, Dr. Lou and the host.
All right, pal.
Good. I have a question with regards to my right hand.
Okay.
I've been experiencing for the longest time now, especially at night, the hand seems to cramp up, and two of the fingers are constantly numb, tingling, and a lot of times sharp pains, and also it even just touching it hurts.
Okay. What two fingers?
I guess the pointer and the one after the pointer.
Okay, so the middle finger and the index finger, which is often related to the median nerve issue. We've talked about this before. So a lot of times at night, what tends to happen is we can sleep in weird ways where we put pressure on that nerve at some point, whether it's at the wrist, in the forearm, at the neck, et cetera, et cetera. And in doing so, it's similar to, it's analogous to when you were a kid and you were in elementary school and you used to sit cross-legged in the gym watching a talent show or something. you were crushing your sciatic nerve, and over time you would develop that numbness and tingling and
the pins and needles.
Yeah, and the pins and needles,
Brutal.
and it would just hurt like hell. And so sleeping, I'm not saying it's the 100% the cause of your problem, Craig. I'm just talking generally here. Most often what I see when people complain about this, where it's an issue at night, I have it myself. It's just poor sleeping patterns, things that you're doing the wrong way that maybe need to be modified. And in doing so, you're able to eliminate that issue. Now, the harder part is figuring out at which point the compression is happening. And so it could be at the wrist. Like a lot of people tend to sleep with, it's hard to do again over the radio, but kind of if you got your hand under your head and it's kind of bent, it's in a full flex position, that's going to put pressure on the nerve. You can all do that as you're listening. Just flex your hand fully, hold pressure there. You're going to start getting numbness and tingling because you're compressing the median nerve, which is the symptom of carpal tunnel. You can also compress in the forearm, get those similar symptoms. A lot of the times what I see is it has to do with head positioning, where your head's not in a neutral position. And so when it's not neutral and it's too flexed to one side or the other, or forward or back, you're going to put pressure on those nerves. It's going to cause radiation all the way down the length of that nerve, because similar to the sciatic nerve, when you're sitting on your butt, you're putting pressure on the butt, but you feel it all the way down the leg because it's going to go through the extent of the nerve.
Okay, would an ultrasound show what that confirm that?
No, an ultrasound would not do that. Physical testing would be the first simple spot where we could essentially just put pressure on certain areas where we know the nerve is and see if it mimics your pain. And then the only other thing that would be really good is some type of conduction study. But again, those conduction studies look at pressure that's being put there, not just at night, but someone who has a disc herniation or a peripheral entrapment syndrome will be identified. This is something that's happening at night, and so we need to kind of identify that more through a lot of questioning and physical exam techniques.
Okay, so in the interim, maybe get a different pillow and
give us a call with the consultation. Again, you can spend a few minutes, 15 minutes. We can go through this a little bit more thoroughly, and I can give you a better idea. So we have your number. We'll give you a call, or you give us a call at 1-855-55-Dr. and we'll talk to you then.
Some lines open. More of your phone calls coming up as we get into the last 10 minutes of the show for this weekend. Anyway, 416-870-6400, star 640 on cell. Dr. Payne Show, Talk Radio, AM 640. 1252, Dr. Payne Show, Dr. Lou Nally, that's him. I like giving your full name once in a while.
Yeah, we got to give your name. The viewers don't even know who you are.
I'm just simply John.
Big John over here, yeah. For sure.
Yeah, that's me. Bill. Hi, Bill. How are you?
Very good. How are you?
Good, pal. What's your concern?
Oh, thanks for taking my call.
No worries.
I've had an issue with my back and pretty much the same symptoms of sciatica that we're talking about for the last 3 years.
Right.
I've gone to, I've had acupuncture, I've had chiropractor, massage therapy, and the one doctor that I went to, he said there's nothing they can do. Now, I do have a little bit of a breakdown of what some x-rays showed up, and it's partial sacralization of the right aspect of L6 and mild-grade anterolisthesis.
Anterolisthesis, yeah, okay.
And some minor degenerative disc changes to the L2 and L3.
Right. So, Bill, you said that you've done a lot of the passive type of treatments where you've seen chiro, et cetera, et cetera.
Yeah.
Have you done, this sounds like it's a chronic issue. Has there been a good rehabilitation component, like exercises that are given to you, proper exercises that you've followed religiously?
Well, not that I follow religiously, but I have done them for a while. But like I say, this issue has been going on for 3 years, so it's mostly just the leg stretches, putting the knee up to the chest type.
Yeah. It definitely sounds like just off of the bat that those are the wrong things to be doing for rehabilitation of the low back. The nerve stretches are good for treating the sciatic component, but the next component is how do you get good core strength to keep your back safe through all the things that you do. And that's often what's overlooked in these instances with people with chronic pain is that they're not given the proper rehabilitation. And then if they are given it, a lot of the times they're not followed religiously. Yeah. And these exercises do need to be followed absolutely religiously. It's actually interesting, and I was saying this to you, John. I'm reading one of Anthony Robbins' books called Unlimited Power. It's one of his first ones, and he has a great quote in there that basically says that there's two types of pain. There's the pain of discipline, which weighs ounces, and then there's the pain of regret, which can weigh tons. And so discipline in these type, and it really hit home with me because a lot of the stuff with pain management, even on the individual, is disciplined. And Bill, I'm not suggesting that you're not disciplined or anything. I just wanted to highlight that point. But it's definitely something that needs to be taken into consideration. Give us a call at the 1-855-55-Dr. Lou number. We can set up a consultation and see how we can help you out further.
Yeah, 1-855-55-Dr. Lou. Bill's the number. We'll move on to Kevin. Hi, Kevin.
Hi, how are you doing?
Good. What's going on?
Back in July, I slept on a hide-a-bed, and I basically created a kink in my back where my lower back and my ribs join. I've gone to chiropractic and massage therapy, and it hasn't really helped. The only way I'm able to get out of bed in the morning is if I sleep kind of sitting up with a pillow under my knees, and then I wake up with no pain. If I sleep on my side, the last time this happened a couple of years ago, I did this for about a year, and then I was able to go back to sleeping normally. But I'm not sure if there's anything specific I can do stretch-wise or...
Yeah, in terms of the specifics, for sure, a lot of the stuff, it's obviously hard for me when it's issues like that to make specific recommendations over the radio, obviously, because I haven't specifically taken a look at your issue. But I would definitely say, again, this is where the consultation for all of the people listening to us, it's available to everyone. It's a free consultation. You can come into the office. We can do it over the phone, whatever it is, when we have more time, go through a lot of questioning. And, we can figure out exactly what might be causing that. Because I need to get a better sense of exactly how much treatment you've had, what you've done in that treatment exactly, et cetera, and it just not, the justice can't really be done right now over the radio for sure. But yeah, give us a call, Kevin, okay?
Got Judy on the line. Hi, Judy.
Hi there, how are you?
Good. How's Fenelon Falls today?
Good.
Other than really snowy.
It's cold, but it's beautiful.
You bet it is.
Thank you so much for taking my call.
What's your concern?
My concern is I'm 62. And I was just diagnosed a couple of years ago with a diastasis recti.
Right.
And I've been doing some physiotherapy and working at it myself at home. And it's not getting any better at all. And I've really been suffering with coughing this week.
Okay.
And it's just killing me. So I'm thinking, is surgery the next step? Or for my age, is it ever going to get better?
Yeah, for people who don't know what that is, diastasis recti, it's when the rectus abdominis, there's a separation and the abdomen expands. It's common in pregnant women, right? Because their abdomen has to expand. And so, there are exercises for sure that you can do to help it. If in the absence of it not working, sometimes, unfortunately, that new form is the reality, or maybe you're being shown the wrong exercises. I'm not really sure what the case is, because that may be a possibility as well. There is the option potentially, I guess, of surgery if you wanted to go that route. I guess at that point, it's not anything that's dangerous per se. It's going to be obviously more cosmetic for you just because, you don't want to have that. So, surgery could be an option. I definitely think that, again, similar to the last caller, give me a call at the 1-855-55-Dr. Lou number. We can discuss a little bit more specifically the exercises that you're doing and see if there's any other things that I can add to that.
Can I ask you one more question about that?
Yep.
What do you think about using a band method? I've been reading on the internet the Tupler method, and they suggest wearing a band, like banding yourself constantly in order to get the memory back.
Yeah. I'm not overly familiar with that method, so I'd have to do a little bit of research on it just so that I can give you a more evidence-based opinion. But that's definitely something I'm happy to do for you.
Oh, thank you so much.
No problem.
In the meantime, Judy, the number is 1-855-55-Dr. Lou. If you remained on the line, guys, hang on. We'll get to you after the show is end, because that's the type of service you provide.
That's right.
So we'll take it for another week. Again, in the meantime, 1-855-55-Dr. Lou is the number. Free consultation. Go see him. Dr. Lou's there. Info@paincarecanada.com. Thanks for all your